Welcome to Mental Notes, a special segment of Rock and Recovery created and presented by Portage Path Behavioral Health.
This is Barb Medlock. I coordinate the support hotline at Portage Path Behavioral Health. Suicide takes life without regard to age or income, education, social standing, race, or gender. It's the 10th leading cause of death for all Americans. The highest rates for suicide are among middle-aged men, people over 85, and our youth. And in our local area of Summit, Stark, and Portage County, we've lost over 550 residents to suicide in the last 3 years. Suicide's one of our most tragic public health problems, and sadly, at some point in our lives, most of us will be touched by suicide, whether we struggle ourselves with suicidal thoughts, or have survived a suicide attempt, or we have lost someone to suicide. One of the most important things we can do towards preventing suicide is to change the way we talk or don't talk about it. If it were any other problem, we would all agree that we can't solve it unless we can call it by its name and talk openly about it. But with suicide, for many people, there's so much stigma, fear, shame, and pain attached to it that it's just too hard to talk about. It's difficult to help people at risk for suicide and for them to ask us for help if we treat suicide as if it's a taboo subject. Our goal should be to encourage open, constructive conversations about suicide and use objective instead of stigmatizing language. People affected by suicide are vulnerable, and they can really fear how others will react. So we need to talk about suicide in a way that's helpful and without judgment. We can start by changing our language and say died by suicide instead of committed suicide. The word committed implies a sin or a crime when in fact a death by suicide is almost always the product of mental illness, intolerable pain, or trauma. We can say died by suicide instead of completed suicide or succeeded at suicide. We can say survived a suicide attempt instead of made a failed attempt. Using this objective language takes the judgment out and allows us to talk about suicide in the same way we would a death from cancer or heart disease. Remember that people who are thinking about suicide are listening to how we talk about it and deciding whether it would be safe to talk to us. Creating an environment where people feel comfortable talking about suicide, are open to reaching out to others, and are comfortable asking for help for themselves is an important part of suicide prevention, and language matters. Once a conversation starts, it opens the door to help, hope, and healing. If you're losing hope and thinking about suicide or are worried about someone, call the Lifeline at 1-800-273-8255 or text the number 4 and the word HOPE to the crisis text line at 741-741.
Thank you for listening to this edition of Mental Notes. For more information about behavioral issues, visit portagepath.org. For meaningful music with a positive message, listen to rockandrecovery.com.